40. What specific actions should the site tech take to monitor for shunt failure in an infant with hydrocephalus who has a VP shunt? The answer is, measure head circumference daily, check fontanelle for bulging, check vital signs, check WBC per doctor's order, and position on opposite side of shunt side or supine. 41. What are the symptoms of shunt failure in a child over 2 years? The answer is, the symptoms of shunt failure in a child over 2 years are lethargy, irritability, headache, vomiting, projectile strabismus, diplopia, which is double vision, paralysis of upward gaze, which is when eyes are looking up, and weakness of arms and legs. 42. What medications inhibit production of cerebrospinal fluid and lower intracranial pressure? The answer is diuretics, acetazolamide diamox, and furosemide Lasix, and dexamethasone decadron. 43. What are the nursing responsibilities and actions to take when a client wears splints and braces? The answer is the nursing responsibilities and actions to take when a client wears splints and braces is to check for skin, keep dry, protect from injury, change positions, and use ointment as ordered. 44. What are the nursing interventions performed to maintain muscle strength in clients with spina bifida and hydrocephalus? The answer is the nursing interventions performed to maintain muscle strength in clients with spina bifida and hydrocephalus are passive range of motion, begin training early. It can be wheelchair sport, lifting weights, and aerobic conditioning or even stretching. 45. What are the complications to watch for when a client with spina bifida does self-catheterization? The answer is the complications to watch for when a client with spina bifida does self-catheterization are bladder infection, skin breakdown, and kidney damage. 46. What is the technique to manage bowel incontinence in clients with spina bifida between 2 to 4 years of age? The answer is the technique to manage bowel incontinence in clients with spina bifida between 2 to 4 years of age is regular potty sitting after meals so that by school age the child's self-esteem will not be compromised. 47. What are the food groups that should be restricted in the diet of a client with spina bifida? The answer is, food groups that should be restricted in the diet of a client with spina bifida are the fat and sweets. 48. What are the early precautions to take with clients with spina bifida who are expected to have many surgeries and frequent hospitalizations? The answer is, the early precautions are, monitor for allergy and anaphylaxis, and use non-latex equipment as early as possible. So monitor for allergy and anaphylaxis, and use non-latex equipment as early as possible. 49. What instructions should you give to clients with spina bifida regarding a health maintenance program? The answer is, the instructions should you give to clients with spina bifida regarding a health maintenance program is, increase physical activity by stretching, do aerobic conditioning, do wheelchair sports, do weightlifting, and make sure they are restricting fats and sweets. So practically make sure spinach bifida patients stretch, do aerobatic conditioning, do wheelchair sports, do weightlifting, and don't let them eat shit that is gonna get them fat.